working with VSI for about 7 or 8 years. We share their offices in Bellevue, and essentially we work very closely with Scott or Gary or Larry to consult with them about their clients' test preparation needs. Many of the VSI clients with whom we work, we will do individual tutoring because as athletes they have schedules that are difficult to accommodate in our regular courses. But we also have several VSI clients taking our classes that we offer in both our Bellevue and Seattle offices. Usually we are working with them for 2 reasons. One, we want to help raise their test scores for admissions purposes, but because a lot of VSI clients are also eligible for academic scholarships, we work to raise their test scores to increase the level of the academic scholarship award. Right now, every college in the United States that requires a standardized test for admissions purposes will accept either the SAT or the ACT without prejudice. There are roughly 800 schools or so that do not require any standardized tests for admissions. But if you are applying to a school that is not test optional, you'll need to take either the SAT or the ACT. And the SAT is offered 7 times a year, the ACT is offered 6 times a year, and there's really no need to take both exams except in a very limited set of circumstances. Well, the best way to prepare for either an SAT or an ACT is to actually prepare for it, right? No student should go in and take the test cold. We recommend, of course, first beginning with diagnostic testing to determine which test is better, and then to allocate between 1 and 3 months for a class or individual tutoring. Typically, in either format, once we're done with covering the material, both the content and the strategy, we want students to take several proctored practice tests prior to their actual exam day. Each of those tests is going to be followed by a review session. That will be right after the exam in the case of our classes, or with an individual tutoring appointment a few days after a student takes a practice test.